How to treat Whitlow. A Whitlow has been defined as a painful skin infection which usually appears on your fingers. Popularly called herpetic Whitlow, it is caused by a virus known as herpes simplex. There are two kinds of viruses that lead to herpetic Whitlows. They are known as type 1 and type 2. It spreads through close contact, mainly through body fluid, with a person infected by the herpes simplex virus. Causes: Whitlows occur because of infections that attack your fingers. This is caused by the herpes simplex virus, and most people are affected by type 1 virus rather than type 2. Risk factors: there are few factors that increase your risk of developing a herpetic Whitlow. These are if you are already suffering from a cold sore or herpes infection and have touched the area, thereby spreading the infection to other parts and increases your risk of Whitlow. Through close contact or touching sore or blister of an already infected person. In case you have a weakened immunity, you are at a high risk of suffering from this condition. Symptoms: there are a few symptoms that will help you identify a Whitlow. You might feel a burning sensation on fingers. At times, it can be uncontrollable or even extreme. There shall be swelling below the fingernails, which can be painful. You may observe a couple of blisters that are filled with fluid. Some symptoms of Whitlow include intense pain, itching, swelling or redness on the fingertips. Small blisters can also be seen. Some general symptoms accompanied with Whitlow include swollen lymph nodes, fever, red streaking on arms. If these symptoms are seen, it indicates a significant infection. Home remedies for Whitlow: 1. Soaking the fingers in antibacterial solution. Take a bowl and fill it half with warm water and 50% antibacterial liquid soap. Dip your wounded fingers in this solution for 15 minutes and should be done thrice daily. This remedy gives best result when signs of redness appears first around the nail. 2. Magnesium sulfate. Take a suitable antiseptic and clean the infected area. Get a tube of magnesium sulfate from the chemist and apply a generous amount on the affected area and cover with cotton wool or lint. Apply a bandage over the covering and it should be changed and repeated over a period of time. If the symptoms still persist, you can consult a medical practitioner as there can be need of antibiotics. 3. Lemon. Take a lemon and make a hole into it. Now, insert the affected finger into this hole for about 10 minutes and it should be done twice daily for quick healing. 4. Rice flour and linseed oil. Make a poultice from rice flour and linseed oil. Apply this poultice to the affected area for quick relief. 5. Chebulic myrobalan. A concoction is prepared if chebulic myrobalan is prepared with tamarind juice. The astringent and acidic action of this concoction helps in curing the problem. This concoction is applied on the affected area for immediate relief. How to reduce risk of Whitlow. You can always reduce the risk of Whitlow and also prevent the contamination of herpes simplex virus to other people by following the given ways. Always use clean towels and change all clothing if you are suffering from genital or oral herpes. Avoid direct contact with exposed herpes lesions, including genital lesions or cold sores. Avoid sucking or chewing the thumb or fingers. Avoid nail biting. Take care while cutting the nails so as to avoid skin cut. During herpes outbreak, cover any wound with a bandage to prevent spread of the infection into the broken skin. Develop habit of washing hands frequently. Safe sex should be practiced. Take a healthy diet to accelerate recuperation. Treatment. Usually, herpetic Whitlows don't take longer than a month to recover and doesn't require any expensive treatment. However, if you feel severe pain in the thumb or fingers, painkillers are usually recommended as they ease the painful sensation. Depending upon the severity of your condition, your doctor might prescribe antiviral medicines. However, it is very important to consult a doctor and not self-medicate to avoid any serious complications. Prevention. You can always prevent Whitlows from spreading to other parts of your body by following few simple steps on a regular basis. These are Never touch infected area, as you are more likely to spread the infection to other areas. You should cover up your fingers with a plaster when affected with Whitlows. Try not to share towels with people infected with herpes virus, especially keep your towels clean on a regular basis and make sure you dry them well. Maintain proper hygiene and sanitation to be safe and prevent spread of the virus. Here are 10 hygiene tips every guy must follow. Do not wear your contact lenses if suffering from Whitlow. You can instead use your spectacles for some time. Read about the art of contact lens maintenance. If your child has been affected with Whitlow, encourage him or her not to suck the thumb to prevent spread of the infection.